A lot of parents want to know what they can do to reduce the amount of discomfort their children feel when they're getting vaccinations. And especially as a child's older, like if they're going in to get their kindergarten shots at age 4 or 5, they'll know what's going on. And one of the worst things you can do is just spring it on them and totally surprise them with it and not give them any time to mentally prep. It's good to tell them what you're going to do. Probably not too far ahead of time, or else they might stew on it for a long time. But when you feel like the time is right, tell them that you're going to be going to the doctor and they're going to be getting shots. And if you tell them that it's not going to hurt, then of course that's a lie, because we all know that shots hurt. And a lot of adults are also afraid of shots. But you can always do something if someone is holding your hand. That's my motto. And so reassure your children by telling them that it's only going to hurt for a few seconds and that you will be there for them. Make it clear that it's not a punishment. In fact, you may try offering a small incentive, like maybe a special treat afterwards or a small outing with mom or dad, if they're courageous and brave while they get their shots. Your reaction before, during, and after the shots will say everything to your child. For example, if a parent psychs themselves out for it because they're afraid of taking their kids, the child is going to sense that. And so when you're explaining it to them, be frank, but don't dwell on it or be overly negative. And when it's happening, the expression on your face will have a lot to do with their reaction. If you're positive and upbeat about it and smile afterwards and say, that wasn't so bad, then 9 times out of 10, the child's also going to say, yeah, that wasn't so bad. I remember taking my kids in for their shots, and my daughter literally hid underneath the chair. And when we lifted up the chair, she was still attached because she was holding on so tightly. And it took us some time to talk her through it. And after it was all done, she herself said, that wasn't bad. And so usually they come to that conclusion on their own. But if the mother or the father is crying and upset and scared, then you can't expect anything less from your kids. If your child ends up having a huge fit while giving the injections, sometimes as a parent you just need to step away and let the doctor and nurses take care of your child. You can step into the corner and maintain eye contact with your child to reassure them that you're there. Or in some cases it's better if the parent isn't even there so they don't associate that experience with their parents. You can do whatever you feel like is best with your child. You can chat with the nurses ahead of time and maybe they can offer you some advice and implement the plan that they feel like will be best for your child. After it's all done, hold your child and reassure them that everything's going to be okay. And like I said, be positive and upbeat and smile. And you may also try rubbing the injection site. It's normal for it to be a little bit red or tender and for it to swell a little bit. It may also be normal for your child to be slightly irritable or to have a low-grade fever. Check with the nurse about side effects that you can expect, and they'll also educate you on ones that warrant more immediate attention, like signs of an allergic reaction. Also ask the doctor before you leave the office about over-the-counter pain relievers that you can offer your child that would be appropriate in helping them to manage those symptoms over the next day or so. Good luck with it, and if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.